Hello, I'm Dr. April Brown, the host of Bringing Intimacy Back radio show, where intimacy is real. And on this show, we are looking at providing an atmosphere to discuss and demonstrate ways to increase intimacy in one's personal relationships. So for many people, they may struggle in finding intimacy, especially in intimate relationships. They're wanting to know, how can I increase intimacy? And that's what today's topic is, just be intimate. As I said, many couples are struggling with it, and this could be due to a variety of reasons, whether it's health, no time for each other, psychological issues, or just feeling overwhelmed or trauma, fear, but a lot of things. The list can go on. However, today I am honored to have on the Bringing Intimacy Back show the Creating Intimacy Coach. That's what she's known as, the Creating Intimacy Coach, Dr. Stacey Friedman from Lake Worth, Florida. Welcome, Dr. Stacy.
Thank you so much. Welcome to you, too.
Yes, thank you so much. Well, Dr. Stacy, like I said, is a clinical sexologist, and she is the Creating Intimacy Coach. You have such a diverse background. Could you tell us a little bit about your journey and what inspired you to be an intimacy coach?
Absolutely. Basically, it started when I was young. I was in high school, I think, is when I remembered it kind of building, because people used to come to me all the time just talking about relationships, about sex, about anything having to do with dating. And I was always the person that people knew that they can trust and they can open up to, and I was very non-judgmental, so people felt that they can trust that I wouldn't look at them funny or, judge what they're doing or who they like. And so that kind of brought me to, when I graduated high school, wanting to get into psychology, because I thought, you know what, I'm really good at listening to people and helping them and giving some great coaching and advice. And so I went into school for psychology, graduated with psychology, and then my path kind of changed once I had kids, and I started doing something a little more medical in the field, doing ultrasound. But then I realized it really wasn't my passion, and I really wanted to help people be more open in the bedroom, have better relationships. And so I went back to get my master's in clinical sexology and got my doctorate in human sexuality and was able to get my certification for sex coaching. And that way I was able to do what I've always wanted to do. So that's kind of how I started. It was all the way from high school.
Yeah, amazing. And I see that you have this desire to help people, and especially help them in the bedroom. And you also have your, when I went on your website, you have this motto, my passion is to help you create yours. That was,
yes. Yeah, exactly. And that's one of the things, is that I am extremely passionate about helping people bring passion. It's funny because my hair is pretty purple, and that's one thing I always felt, is that purple is a very passionate color, and that's just one of my absolute favorite colors. So I have purple nails, purple hair, purple purses, purple. I'm like a purple passion person. So for me, it was all just about what I was passionate about, and I just love when people are open-minded and they can be their authentic selves. There's so many people with sex being such a taboo subject, and me being so open about it, I was judged all the time because of my sexuality and who I was. And I just felt like, you know what, I want to help people have more sex positivity and be more passionate about their relationships, and that's where I got my motto from.
Okay, perfect. Yeah, and I definitely understand. I have purple in my logo, so I understand the passion of purple, yes. I also know that you, from your background, you're a consultant for adult novelties. Can you tell me how you got into that business?
Yeah, absolutely. Once I had kids, I wanted to stay home and be able to, go do different types of home parties in the evenings when my ex-husband was with me. And so that gave me an opportunity where I was starting to do just regular home parties. And then I was like, you know what, this is so boring. And all my friends are like, you need to do the adult toys. You need to do that. You'd be so good. And even though I thought that it would be something I wanted to do, I was fearful because of the judgment, because of that. And I said, you know what? This is why I want to do this. It's because I don't want people to feel that they have to be judged because of who they are. So I started going into the romance parties. I did the toy parties. And what I realized is that when I was sitting there doing the ordering process, people would sit there and they ask me question after question after question. Sometimes I'd be in with a customer for like a half an hour, and I'm like, I should be getting paid for this, not just on an $8 lotion, So, and then I'm like, and people used to call me and just say, oh, that thing you suggested was great. So that's kind of how I got into that. And I don't do the parties as much anymore, but I still do some type of workshops that help people learn about the adult novelties and adult toys, because that could be something that could really spice up a relationship and help bring back some of that intimacy and sexuality.
Yes, and so from your background, what is your philosophy of intimacy?
Well, basically intimacy it could be a physical or emotional or communication type of connection to the person. It's truly, I feel it's truly about knowing someone deeply enough to be able to be completely free in their presence, to be able to be vulnerable and share all of your intimate details, basically having a best friend that you know that is not going to judge you for who you are, where you feel safe and you can be your authentic self. And that's what I feel intimacy is, and that's what I try to provide to my clients. Okay,
yeah, definitely. And as you've been talking about how people are judged about sex and intimacy. And what have you seen? Can you explain more about that judgment? Because I think sometimes that hurts people in the bedroom when they feel like they're always being judged.
Oh, 100%, because so many times people are afraid to speak to their partners because let's say they saw something on either a porn that they watched or they talked to a friend and their friend said, oh, yeah, we did this, and they're like, God, I wish I could do that, but if my husband ever found out or if my wife ever found out I was interested in something like this, they would look at me and think either I was having an affair or what's wrong with this person. I mean, people have fantasies and are afraid to bring it up to their partners due to the fear of being judged, and it really affects the relationship. So I knew that any relationship I was going to be in, if that person was not able to understand that, listen, I'm going to tell you, if I want to sit there and be strapped up to the ceiling, I'm going to tell you. You know what I mean? I want people to be able to not have that fear of being judged, because the amount of intensity and intimacy and the feelings that you get in that type of relationship can keep that relationship lasting for a very long time.
Right, because when you're judged, you don't feel like you can really
you can't open up.
You can't open up, and you can't learn things or even learn about each other and what each other like. Yes, if you can't really talk about it, or you feel like I'm being judged. And so, yes, and I'm even thinking as you're in this business that sometimes you're even judged in that aspect, too, of being in this business. Yes. Yes.
Oh, yeah, definitely. I get judged a lot because people automatically assume when you're in the business of sex in any kind of way, first of all, you're allowed to be harassed. That's one of the things that people judge about a lot, is they feel that you're open to a harassment, which I get on a daily basis, unfortunately. I've kind of learned how to pick and choose where I can get rid of some of that. But, people think that, oh, well, she's in this business, she must be a slut, or she must be this or that. I'm a professional. I have a doctorate. I am educated. And there shouldn't be any judgment against people because of who they are and what they do. And, if it works and you're helping others, that's what it's about. For me, it's about helping others.
Right.
And if I'm able to get people happier in the bedroom, then I've done my job.
Okay. And so one last thing on this judgment thing, if there's someone out there who feel like I can't talk to my partner, or I can't even talk about sex or intimacy because I feel like I'm being judged, what's one thing that we could just tell them that, hey, it's okay to be you?
I think that if you can empower people to understand that it's very, very important to be able to talk, what I try to do is I tell people to go to a place outside of the bedroom, because a lot of times people may want to talk while they're in the bedroom, and it's not a safe place because that's going to, I guess, kind of deter people because you get a little bit more intimidated that way. So when you go out at night one time and you're walking along the beach and, or you're out to dinner in a nice restaurant, say something that maybe interests you and be like, oh, yeah, I saw this article, which maybe you didn't. You just have this fantasy of, being tied up, for example. To say, oh, yeah, I read this article about someone, using these handcuffs. It was the craziest thing. And see what your partner says. And then you could say something like, yeah, I was wondering, what would that be like? And don't go right out and say, oh, I want to be handcuffed. Maybe bring it up in that type of a manner, or just, say, oh, I saw this movie like 50 Shades of Grey, and they were talking about these Benoit ball things. What is that? I wonder what that is. That might be neat to try, or, examples like that where you're not flat out saying what you want, but you're kind of slowly introducing it so your partner can have the opportunity to say, oh, God, that's ridiculous. No, thank you. Or you say, oh, that might be actually kind of cool. Maybe we should try that. Right. It might be fun. So it's just about starting out slow.
Okay, great. Yeah, and I think that opens up people to be more intimate.
Exactly. It opens up the line of communication.
Yeah, definitely. So we're going to take a short break now, and then when we return, we'll have more intimate conversations with Dr. Stacy on how to increase intimacy.
Sounds great.
Welcome back to the Bringing Intimacy show, where intimacy is real. Today we have the honor of having Dr. Stacy. She is the Creating Intimacy Coach, and we have been discussing intimacy and also the judgment that sometimes happens when you start talking about sex, but how as a person or a couple that you can go and start talking about it in a non-judgmental, very kind of open way. And so for right now, I was wondering that we are talking about intimacy, but Stacy, do you think you could let our audience know that the various types of intimacy that happens within a couple?
Absolutely. There's actually a few different types of intimacy. People a lot of times think that intimacy is just about sexuality, and it's actually couldn't be further from the truth. There's a lot of different types of intimacy, such as emotional intimacy. There's the physical intimacy, obviously, intellectual intimacy, spiritual, experiential intimacy. Basically, the whole idea is the more aspects of intimacy that you can fulfill in your relationship, that's going to bring things together and keep you in a better state in your relationship.
Okay, so there seems to be a variety of them. Are one type of intimacy more important in a relationship than another, or what are your thoughts on that?
You know what, just to kind of go over a couple different parts of the intimacy, like let's say emotional intimacy. That's basically meaning that you can talk to your partner and share your innermost thoughts. And I think that a lot of times, especially for women, allows you to feel that much closer to your partner when your partner listens to you. And we go back to the judging, doesn't judge you. You're able to have that person as your best friend and feel that you could share your deepest dreams and fantasies and secrets and your hopes and your future. That, I think, is very, very important. Intellectual intimacy, it's like a tongue twister, is where that if you're deeply passionate about something, let's say you're truly passionate about books and reading or theater or opera or art, that you can share these types of intimacy with your partner and have something to discuss with them, something in common is something that is important when it comes to intimacy. What was the other one? Physical intimacy is more about the hugging and the kissing, the cuddling. It's more about touching and holding hands, not sexual, where you're talking about more of the intercourse, but it's more about the cuddle hormone that they call oxytocin, where women usually get a higher amount of that when they have that cuddle hormone, and that helps them become a little bit closer and feeling more intimate towards their partner. The experiential intimacy is when you're doing different things with your partner, just even like a date night or going to see a movie, things like that. Spiritual is pretty much if you go to temple, you go to church, or even just being outside and looking at the stars and feeling that energy. That's kind of more about the spiritual. But as far as if one's more important than the other, I feel that there needs to be a balance. And some people need, it's almost like that 5 love languages. Some people need certain types of intimacy more to feel connected than others. There's some people that need to have that physical intimacy in order to feel more, where they don't necessarily care about watching a movie or going out on a date, you know?
Right.
But as far as going to the sexual intimacy, I feel in general there has to be some of those other ones before you're going to get to that sexual, especially for the women.
Yes, definitely. And as you mentioned, the 5 love languages, which are your touch, your words of affirmation, the service, the gifts, and quality time. And as you were saying, talking about women, and we're going to talk about women and men, I do, in my practice, in a variety of things, sometimes I see that couples are struggling with that emotional intimacy. So what things do you do to help them if they're struggling with that emotional intimacy, especially maybe a woman is, if she doesn't feel quite emotionally connected? She loves the physical aspect and others, and they go do everything, but that emotional aspect is suffering.
Yeah, I think that the emotional intimacy, people struggle with communication so much because they don't understand that it's something that needs to be constant in a marriage. And usually the first 2 years are when you have like this love high. You know, most people have that first 2 years where your partner is perfect. Your partner's not doing anything wrong. All of your hormone levels are raised. The men have their testosterone raised. The women have their serotonin, their oxytocin raised. And then all of a sudden after those 2 years, they drop because people become more comfortable and it's just normal energy of the body. And a lot of times when that happens, you start seeing some faults from your partner. You start seeing some things. You get more complacent, and people stop doing what they did in the first 2 years. So when they are struggling with the emotional intimacy, it's very important to keep that communication open. And they need to be able to still continue to date through their relationship. They need to be able to share their experiences and, you know, always plan to have a date night or do something to keep it stimulated.
Right. And one of the things I was thinking when you were talking about the communication and stuff is also being able to not assume your partner knows what you need.
100%, yes. Because so many times you think, oh, well, my partner should know I'm not happy, or my partner should know that this is not turning me on. You know, and not just that, but what you wanted when you first met could be different if you're together in 10 years. You may not feel the same if he touches you in a certain spot. So it's important for you to, first of all, know yourself, know your body, know your own desires. So that way you're able to communicate that to your partner and be able to keep that line of communication. And do, like you said, do not assume that your partner knows what you need all the time.
Yeah, and you just made a great point about our bodies because as time goes by, our bodies change. So sometimes other things change. Yeah. And so what about those couples who are having problems where they say one has a low sex drive, one has a high sex drive?
So you mean like almost every couple in my practice? That is probably...
Yes, I noticed actually you have you address that on your website. So
that is one of my specialties. That is one of my specialties because I think that probably 99% of people have some type of sexual or intimate issue and should be talking to some type of a coach or counselor, but they don't because they feel that they are either embarrassed or something's wrong with them, or, you know, it's people are afraid to talk about it. But the mismatched sex drives is extremely common, and I think a lot of it are for reasons of just either being busy, people on their different schedules, but what I always tell people, the first thing that they should do is make sure that their hormones are fine. You know, go to the doctor and check your testosterone, your estrogen, progesterone. Make sure there's no medical issues like diabetes or thyroid or, you know, depression. You know, it depends a lot, too, if people are on medication.
Right, definitely.
You know, yeah, so all these types of things can affect the sex drive. And, you know, people are surprised after they have a baby and the baby's a year old. They're thinking, why am I so tired? Why am I not in the mood for sex? Well, you have a 1-year-old who you're, like, constantly on top of you. So I think that I keep going back to communication. What you need to do is talk with your partner and see, you know what, maybe there's a compromise. If he wants to do it at night and you want to do it in the morning, then maybe sometimes wake up a little bit earlier. And what can you do in the morning that might help you wake up a little bit? Maybe it's taking a shower. So maybe instead of having sex in the bed, go in the shower. Try something different that may be more stimulating for you.
Right.
Yeah, and if you're tired at the end of the night, then maybe have your partner just give you a massage. And when we're talking sex, it needs to not just be the in and out procedure. It needs to not just be intercourse.
Yes.
It's about the intimacy as well. And a lot of times, if the person knows that they don't have to feel that pressure to perform and they can actually enjoy the pleasure, they might allow themselves to be turned on, and then all of a sudden, then there you have your performance. Then they're like, you know what? I was just relaxing and I was just getting a massage, but I'm actually kind of turned on right now. But if they know that every single time that they have to ask for a massage and the partner is going to be like, okay, can we have sex now? Then they're not going to want that massage, and they're going to keep staying mismatched.
Right.
So it's important to, do that. Plus, have a quickie once in a while. There's nothing wrong with a quickie. Spicing it up, being able to get out of the monotony of the relationship. Don't do it in the bedroom. Do it on the couch. Go to the beach and take a walk and then hide behind some of the trees and just, give the guy a little quick hand job. Just something fun.
Yeah, different.
Exactly. Take a game. Take the little dice. They have the dice. Have you seen those?
Oh, yes. We've seen it, and you roll it and you play the position.
Exactly. I have those on my site too. But it's something fun where each dice says a body part, and each dice says, or each side says what to do with it. So you might say kiss nipple or suck toes or whatever it is. And things like that can just make it fun. So even if you may not be in the mood, it's something that you can do to kind of spice it up. I will tell you one other thing, though. A lot of people, especially women, feel that they don't have desire, because I have a lot of women come in with low libido. But what I try to explain, that as you get older, especially in a long-term relationship, many times women do not have desire, and that is completely normal because the hormones do drop. And so it is okay to not have desire, but if the partner is able to do things like this to help stimulate, that desire will build. So just because they may not have that desire at the time, they can build it.
They can build it. Great. And one of the things that you were saying earlier, which kind of gets back to what you're just saying now, in the sense of even if you have low desire or you have an issue with sex or intimacy, it's okay to go ahead and get help, because sex is normal, just like people go get help for going to the bathroom issues. So, yes. And I guess one of the things, go on.
Yeah, go ahead.
I
was going to say that I think that people, you think about it, you're educated about everything in life except for sex. And the sex education they have in schools is really all about abstinence. They don't teach you anything about intimacy and sexuality. So people think that they should know exactly what they're doing. And the problem is that people are very, very complex, especially women. Women can be a pain in the ass. They can be really difficult because there's so many parts of more so of a woman than there is of a man, and there's so many things that are different for people. Some people like it soft, some people like it fast, hard, slow, right side, left side, clitoris is too many nerves. They only like it on the inside, outside. There's so many things, and you're not going to know it all. And a lot of times when people don't have good sex, or they're not enjoying themselves, or the women aren't having orgasms and they're faking it, of course they're not going to want to have sex. They're not going to be in the mood. So I think when you start realizing that it's becoming a chore, or you want to try to spice it up and do something different, or you're just not enjoying it and you're afraid to tell your partner that they don't know what they're doing, or that the woman doesn't know how to, go down and do oral, or the man, when he's fingering her, has a sharp nail and she keeps telling him, is afraid to tell him how to cut it. There's little things that I've talked to people and I've heard, oh, well, you know what, he's hurting me when he's doing it, but they're afraid to tell him to stop because they don't want to make him feel bad.
Okay.
So I think at those times, it's time to just get professional help where people can guide you through that and be able to express those concerns without making that person feel like they have to be defensive back. Does that make sense?
Okay. Yeah, definitely. I mean, that's when a person should get a sex coach.
That's exactly right. And what I do is different than therapy is because I'm not working necessarily with the mental health of like trauma and abuse. I'm working with, you think about it, you know how to kick a ball.
Right.
But when you want to go play soccer, you may not know the sport as well, or you want to get better. So you hire a soccer coach, or you hire a tutor because you want to get better in math. It's the same type of thing. You're hiring someone who is able to coach you and help you reach your goals to be able to do better in the bedroom. Who doesn't want that? Why would you not want to have the best?
Yes, definitely. Yes. So as a sex coach, you help them figure out their issues, but also help them with any type of problems or anything that may be going on.
Exactly. Any type of dysfunction. I mean, my specialties are working with women. There's a lot of women with painful sex that don't know how to get past that or how to have intimacy with that. So I work with a lot of people with the mismatched sex drive and women that need to really kind of get better feelings and orgasmic difficulties and things like that.
All right. Well, thank you so much. This has been an intriguing conversation about learning about a variety of different ways that we can help people who have intimacy problems. Well, we're going to take a short break now, and when we return, we'll go to our toolbox segment. Thanks. Welcome back to the Bringing Intimacy Back show, where intimacy is real. I'm your host, and today we've been talking with Dr. Stacy, the Creating Intimacy Coach, and she has been discussing different ways of why some of us, and we're in a variety of relationships, but when we're in our relationships with our significant other of any sort, if we're having issues in the bedroom, we've been discussing a variety of issues that may happen in the bedroom and how to get help. Now we're in the part of our show where we're going to talk about Toolbox, where we're going to discuss and provide examples of a variety of tools that can benefit you as our audience members. So, Dr. Stacy, many of our listeners are wanting to increase intimacy in their relationship with significant others. From your toolbox, what is some effective tools to increase intimacy that you can share with our audience members?
Well, one of the things I think is very important is when I talk to people, I ask them many times, when was the last time that you gave your partner a kiss? And I don't mean just a peck on the lips or the cheek. I mean an actual kiss with tongue or a hug that lasts more than, 2 seconds. And many times the people that are lacking the intimacy or having sexual issues, they can't answer that question because they can't remember when. And I think one of the most important...
Wow, that's impactful. Yes.
It is. It's sad because it becomes to a point where they're actually uncomfortable to touch each other. So it's extremely important that kissing and hugging needs to be done because kissing has been shown to improve intimacy, and it also lowers stress and cholesterol. And usually the more people kiss, the more satisfaction they have in their relationship. And the same thing with the hugging. I try to tell people to do the hug exercise. I say, go home, hug each other, don't look at your watch, but do it at least for 20 seconds, and smell the person's hair, their skin, feel the heartbeat, feel the warmth. Reconnect to your partner's body rather than just a hug and a pat on the back. And I'll tell you, people come in. What's that?
No, I was just thinking, if you're not kissing or hugging your partner at all, you're like treating your partner like anyone else in your life.
Exactly.
They don't have a special part.
Yeah, it's a roommate. But that's majority of the time when I ask people, they don't do that. And I've had people come in after they do it actually in the room and they cry, and I try not to cry because it's very, very powerful what a hug can do. So I would say that that's one of the most important things is the kiss and the hug. Make sure that you hug every day for at least 15 to 20 seconds once a day to be able to release that bonding cuddle hormone, especially for the women.
Okay. All right. Great. What is another tool that our audience members can learn from?
Well, we were talking about the love language. I keep bringing that up because I think it's very important that in order to build the intimacy with your partner, you need to know what that partner needs to feel loved, not what you need, but what that partner needs. You don't want to be giving that partner a lot of gifts. If, let's say, you really love gifts and you just want to give your partner gifts and you feel that they're not reacting the way you want them to react, well, they may not need those gifts to feel that love. But yet if you give them positive words of affirmation such as, wow, you look beautiful, or, oh, my God, I'm so happy to be with you, and all these words of, I'm proud of you, you look, just you make me feel so amazing, someone may react to that differently. So I think that if you're able to know your partner's love language, some people want more physical touch. Some people don't need it. So that is something that can definitely help improve the intimacy because you're loving that person the way they need to be loved and not the way you want to be loved. Does
exactly, yeah. Yeah, exactly. No, I work with couples, and many times I realize a person will love someone the way they want to be loved.
Right.
Yes. So understanding your partner's love language is critical.
Exactly. So that way you're not just doing what you want and you're not getting the results because they're not feeling it the way you would feel it. So it's important to communicate and find out how each other needs to be loved.
Okay, great. Well, do you have another tool?
I got lots of tools.
Yes, I know you do.
But we'll talk about. I'll just throw a couple other ideas out there. But in order to do intimacy to get you more intimate in the bedroom, you need to start outside of the bedroom, and that could be something just as simple as laughing. Laughing can really, really connect people because that shows trust. So go to a comedy club. You always feel good after you get out of a comedy club and you're laughing and you're smiling and you're playful. Do something romantic. Do something different. Make sure that you don't just keep your dates monotonous. Don't just go out to a movie and dinner. Go to a bowling alley or a pinball museum. Take a bath, put candles. Books. Have you heard of like these books of 101 questions or things like that?
Yes.
Those are great because you're learning things about your partner that maybe you never would know or wouldn't even think to ask. Mm-hmm. And that gives you an opportunity.
Yeah, and the things that you're mentioning kind of relates to also people getting out of their
comfort
mind. Yeah, comfort zone. But also I think sometimes what happens is people think so much that it just, they don't participate. They don't act.
Right.
They're not in the present moment because they're in their mind last week, 10 days from now. And also that affects intimacy in so many ways. Performance and the anxiety, basically.
Right. And I want to just piggyback on what you just said about being in the moment. Mm-hmm. When it comes to being sexual and being in the bedroom, one of the ways that you can ruin your intimacy is thinking to yourself about the laundry, about the kids, about things you have to do. To really increase that sexual intimacy, you need to be in the moment. You're there. Why not enjoy it? We all have the ability and the right, the sexual human right, to enjoy ourselves and our body and our orgasms and appreciate in that moment, and that connection that you allow yourself when you're in that moment is going to be very beneficial for your relationship.
Great, fantastic. I know that you, like we said in the beginning, know a lot about sexual toys. Mm-hmm. Yes. Could you give us a few that will help increase intimacy or let us know about a few?
That's one of the things that can be tricky in some relationships, too, because some men get very intimidated by certain toys. But there's such a variety of toys out there that can be very non-phallic and non-intimidating. And a lot of women, it's okay that women need toys sometimes, and it shouldn't make the man feel less than. If anything, sometimes these toys can make the experience much better. So they have lotions and creams to help stimulate the clitoris. They have some things that also help the man. There's so many different things, just as simple as a silver bullet, which is just a little silver, looks like a silver bullet, and it vibrates. And it's something that you can do for the woman. It's something that a guy doesn't realize sometimes that they may enjoy the underside of the balls being stimulated. And so it's just something to experiment and play with. And there's so many toys out there that you can find something to add to your little bedroom activities.
Right. And one of the things she said in the beginning just now I thought was very profound, that the toy isn't replacing person X or person C. It's just enhancing the
Exactly. And the problem is that 75% of women cannot have an orgasm through intercourse. They have to have clitoral, 75, at least 75%, yeah. And a lot of women don't realize that, and they think something is wrong when they're having sex and they're not able to have an orgasm, which is why so many women fake it. And the men think that they're having an orgasm, so they're not doing anything different to try to make it more enjoyable for the woman. So I see this cycle all the time. So many times, just something simple like a bullet you can use while you're having sex, because 35% of the women can have sex through intercourse by the G-spot, but the rest need clitoral stimulation. So have sex, give the guy less work that he has to do, use the toy, and have the orgasm while you're having sex. And it doesn't matter what kind of an orgasm it is. You know, it just matters that you're enjoying yourself and having fun.
Right. And really, I mean, with that statistics, they don't teach that. And so from the media's perspective, you would think, oh, my gosh, something is abnormal or something
people think something's wrong with them all
me.
the time. Yeah.
Right. So I'm glad. Thank you so much for helping to normalize that, because I know that's like something. Yes. Is there anything else that you particularly would like our audience members to know about increasing intimacy?
One last thing I think is extremely important, and it's kind of taboo for many people, masturbation, especially for women.
Yes.
I think that a woman needs to know her body. It's extremely important, because if you don't know your body, your partner is definitely not going to be able to figure out what you need.
Yes. How would he know? Yes.
Exactly. So I think it's very important for women. I say that if you don't use it, you're going to lose it, because the vaginal tissue atrophies. It dies. So you need to keep the blood flowing to the genitals. Even if you don't have sex every week, masturbate. Enjoy yourself.
Right.
Learn your body, and that way it can help you have a much better experience with your partner.
Okay, definitely. Thank you so much for even for that tip right there, because sometimes people think it's, oh, my gosh, I'm not supposed to touch my own body. And
Go for it.
Yes.
I give permission.
Yes, thank you so much. So how can our audience members get to know or get to contact you or know more about you?
Well, I have a website, and it's drstacy.org, and my name is spelled S-T-A-C-Y, so the website is drstacy.org. Excuse me, all of my information is on there. My phone number is 561.
You could just do the...
Just the website?
Just the website would be helpful. Yes,
that's on there. And I did want to explain also, I work with people all over the world. So I'm able to do video calls and phone sessions, video sessions. So anyone can reach me, and I do offer a 15-minute complimentary consult to see if my services are right for you.
Oh, wonderful. Okay.
I want people to get to know me and trust that I'm the right person for them.
Right. And I'm just going to ask, instead of assuming, with the video sessions, you can do it with both parties, correct?
Correct, yep.
Okay. And you work with all type of relationships?
Any type of relationships. One of my specialties is LGBT, so it's completely open to any single person in this type of world.
Okay, all right. Well, thank you so much. It's been a pleasure and honor to have you on our show. You've provided us with so much information, and I thank you sincerely. And to my audience members, stay tuned for our next Bringing Intimacy Back show, where intimacy is real. Thanks.
Thank you.